We are a trade organization made up primarily of skilled nursing facilities, and about 500 or 600 skilled nursing facilities. We vacillate between that number and 500 associate members, all with the mission of providing the best long-term care experience in the state of Florida for Florida's frail and elderly. Our association, to be a little more specific, is very strong in advocacy, specifically when it comes to the Florida legislature and lobbying efforts for our skilled nursing facilities. So that's probably, I would say, that one of the top most important thing to our members is that we're effective at the Florida legislature. Now, we also offer to our members, our member facilities, we try to have cutting edge training on the multitude of regulatory issues that come their way, and offer them a trade show and networking opportunities as well. I think that if you don't have money to pay for good quality care and to staff proper staffing levels to deliver that care, I think you're running into a big problem. That's a challenge every year. In the state of Florida this year, we had a $2 billion deficit to our budget. And when there's, the state of Florida also requires that the budget be balanced. So if there's a $2 billion deficit, they can't just say, I'll pay you Tuesday for a hamburger today. They have to balance the budget. And so that money has to come from somewhere. And the healthcare line item happens to be one of the biggest line items that they go to. So funding, I would say, is a number one challenge for the elderly. Also, it's important for proper placement for the elderly as well. A lot is changing in healthcare, as everybody is aware, and the nursing home of today looks nothing like the nursing home of 20 years ago. Community involvement is very important. That starts at a grassroots level for the administrator, but also legislative involvement as well. I think that a new administrator, if they want to impact the system, then they have to be part of that system. They have to get involved in it. In every legislative session, the lawmakers are making laws or considering laws that will affect that administrator. If that administrator doesn't have a voice and doesn't have a say in what's going on, then those laws will be dictated to them by other interest groups. And so I think it's really important not only to get involved in community, and by that I mean plugging into the Rotary, Chamber of Commerce, becoming a go-to person for healthcare, becoming the expert in your field, but also at your state capital. In Florida, it's Tallahassee, and it's through our association. Becoming involved, knowing the lawmakers, and when the lawmakers are back home, bring them to your skilled nursing facility or whatever facility you're working at, and make sure you tour them around. So you have lawmakers, for instance, based on my other question, you have lawmakers that haven't been in a nursing home in 20 years. So they have a picture in their mind of what is a skilled nursing facility. I'm using those terms interchangeably, but they have a picture in their mind of what it looks like. And in many cases, we've toured lawmakers for a skilled nursing facility, and they have been absolutely amazed at what goes on there. It completely blows away their preconceived notions. Yeah, that's a great question. An administrator really is a business person. The clinical side for an administrator will be handled by the director of nursing and the staff. So it's really important. I found that the successful administrators in the state of Florida are administrators that can identify that great director of nursing to help them on the clinical piece. On the flip side, this administrator really needs to be strong in business and finance. They need to understand how the books function. They need to understand marketing, the marketing aspect of it, but also they need to understand the leadership aspect of it, because they are going to lead? I mean, if you think about this, an administrator really leads a sometimes a large company, but a multi-million-dollar organization. So a strong business background is important. I think as we continue to see the acute mixes change over time, I'd like to see better communication over the continuum of care so that we can make sure we're not duplicating efforts and that people are properly placed.